Hello everyone. This presentation is on Sang Ju Yin, also called mulberry leaf and chrysanthemum decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Sang Ju Yin is classified under release the exterior. A representative pattern is early-stage wind warmth affecting the lung with cough as the main symptom. Important ingredients include Sang Yi, Ju Hua, Xing Ren, Lian Kaio, Bo He, Jai Jiang, Gan Kao, Lu Jian. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 29-year-old man with dry cough, mild thirst, and low-grade fever. History of allergic rhinitis. The current medicines are cetirizine, ibuprofen as needed, omeprazole. This case gives a plausible reason to consider Sang Ju Yin, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Gan Kao plus diuretics. The mechanism is licorice can cause sodium retention and potassium loss, which can be amplified by potassium-wasting diuretics. The clinical significance is low in a short course, but rises with higher doses or prolonged use. My management plan is avoid extra licorice, monitor blood pressure and electrolytes in high-risk patients. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Ju Hua plus antithrombotic drugs. The mechanism is chrysanthemum has laboratory antiplatelet signals. Clinical evidence for a meaningful interaction is limited. The clinical significance is probably low, but caution is reasonable with warfarin, clopidogrel or multiple bleeding risk drugs. My management plan is ask about bruising or bleeding and avoid unnecessary concurrent blood thinning supplements. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Bo He plus oral medicines. The mechanism is peppermint can change gastrointestinal motility and may affect how some oral medicines are tolerated or absorbed. The clinical significance is usually low, more relevant when a drug has a narrow therapeutic window or reflux is worsened. My management plan is separate timing if needed and monitor the clinical effect of important oral medicines. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Sang Ju Yin may be reasonable when the patient's presentation matches early-stage wind warmth affecting the lung with cough as the main symptom. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula List, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.